Good evening, sir. My name is Raymond Powell Jr. I am a student nurse at the University of Southern Mississippi, and today we have an order from the physician to have a Foley catheter inserted for you. Now, what a Foley catheter is, it is a method of draining your urine by inserting a small tube through your urethra and into your bladder. Okay. Alrighty, sir. Can you verify your name and date of birth for me? Thank you so much. Before we begin, do you have any allergies to anything such as latex? No. Iodine? No. Or betadine? No. Thank you, sir. So I'll begin by performing perineal care. For this part, you use clean gloves. Okay. On a male, you can wash with regular soap and water. There we go. Grab it with your non-dominant hand. With your dominant hand, you want a circular motion, starting with the meatus 3 times, and then wipe down towards the shaft. Come back, rinse off the soap and water, and ensure that the perineal area is dried completely. So now that the perineal care is completed, sir, we can begin with Foley catheter insertion. This is only after completing proper hand washing technique, which is washing hands with soap and water for 15 to 20 seconds, or using proper hand sanitizing technique. Again, opening Foley catheter kit. And since you are a male, sir, we can leave you in the supine position with your legs kind of spread out slightly. For this part of the procedure, I will be wearing sterile gloves, because one of the most important components of inserting a Foley catheter is maintaining sterility. Okay, sir. So the first step in inserting a Foley catheter would be to take out the catheter, ensuring it doesn't come into any unnecessary contact with any bed sheets or anything outside of the sterile field. I would insert the iodine syringe, twisting it. Set that right there. Next, I can open the betadine, squirt some out into the tray. Take this with my non-dominant hand, grab the penis. I will go 3 times in the same manner of performing perineal care, 3 times around the meatus and then down the shaft. Once that is complete, take out my tube with lubrication, insert it directly into the meatus and insert it down into the urethra. All right, once that is complete, can begin inserting the catheter. Now, sir, this may be uncomfortable for you, so I'm just going to ask that you take some deep breaths. You'd insert the tube, always remaining mindful of the urine return. And once the urine return is found, I would just insert until the catheter is completely into the urethra. And since the urethra is longer in males, you would keep going until only that Y is visible. Then insert the balloon. Holding it all the way down. Okay. And then I would proceed to take my urine sample, going here. Okay. And I would insert it here. Okay. So, sir, I took the urine sample so that they can send it down to the lab for testing. And also, once the balloon has been inflated, I can yank a little bit on the tube to ensure that it's in the right place to check for tension. Okay. Ready? So for a male, you would lift the penis up towards the abdomen. You would put the catheter on the lower abdomen for a male. You would secure it with a piece of tape. Okay. Okay. And then once it has been secured, you can hang the bag at the bottom of the bed. And when hanging the bag, you want to ensure that it is beneath the bladder so that everything can drain accordingly. And again, sterility is one of the most key components when inserting a Foley catheter. And had I inserted it into the wrong area on a female or a male, I would leave it there and I would restart the process by getting an entirely new Foley catheter kit, and I'm restarting the process. Okay. Remove. All right. Hello, sir. My name is Raymond Powell, Jr. And it has been a few days, and now the physician has ordered that we remove your Foley catheter for you. Okay, once again, could you verify your name and date of birth for me? Thank you so much. And for this portion of the procedure, since it is just a removal, I'll once again perform proper hand washing technique and don clean gloves. Alright, sir, so I'm going to begin by emptying your bag for you. Okay, so what I would do is I would take this and empty it most likely into either a bedpan or into I would empty this into a bedpan and dispose of it in a restroom for you. All right, so this may be a little uncomfortable for you as I remove it, so I'm just going to ask that you take a few deep breaths. First thing you have to do is deflate the balloon. If a nurse or a physician tried to remove a Foley catheter prior to deflating the balloon, that could lead to some serious problems with the patient's urinary tract and their urethra, and that might require some corrective surgeries to remove it. Okay, once all 10 cc's of iodine have returned, you can begin removing the catheter. Okay, sir. So a Foley catheter, I would dispose of that for you also. And before I left, I would make sure that the bed was returned back to its lowest position and that the bed rails are engaged to reduce the risk of the patient falling out of the bed. All right.